I think if anybody has suggestions on that, very much welcome. We are trying to address that so far through what we offer through the messaging system. So there's a messaging system that you can contact another member, that you can just identify through the profile, so that maybe there is some interest for experience sharing and learning. We also try to really promote to access the grey materials, so not the formal, but there is often an issue related to that with the quality, or agencies who want to release these grey materials, but we are trying to promote that further, or to develop that further. And there is also those who are involved in the steering committee, the co-facilitators. They have their own networking of accessing information, and that is how we try to address that so far. If there are suggestions from the group, if we can to do better on that, welcome.
I have many questions, but I only have time for answering two, they said. So I'm going to try to answer the one about how does it compare to MRP and other HMIS systems. So the reason why the World Vision CMM database was developed was because MRP's first intention, as Emily shared, was to only track SFP data. And we realized that we really needed to, World Vision realized that we really need to be able to track all components of our CMM programs. And that's why we went ahead with developing our database, but at the same time, we made sure that we are tracking the same indicators as MRP, and we also piloted the MRP, and we contributed to their meta-analysis as well, because we are collecting the same indicators. So we tried as much as possible to be able to align the two. And there's even the indicators that we selected, there's a reason why we selected and limited to those indicators. I know that we could have selected many more, but it became too intense and too heavy for our program staff to be able to track all these indicators monthly. So we had to limit the indicators that we could track to the only very essential ones that they need for the ongoing monitoring of the program for CMM. And we are tracking the relapse indicator. I mentioned that. And then the online capability and the mHealth. That's the second question that I'm going to take. They asked, is the mHealth component, does it help to reduce defaulter rate? We hope so. That's what we're hoping, because there is a messaging component. And what this messaging component does is, if the child did not show up or needs to be followed up, then the facilitator, health facility, or the person who has the mobile phone who's tracking it will get a message and say, you need to follow up with these children. And even if they were referred to an SC, they would get a message and say, okay, this child was referred to an SC, now you need to follow up with this child. So they would be getting these prompts. So we're hoping that the defaulter rate will decrease. And the reason why it's an online system and we didn't go ahead with the offline component is because we explored this option, and it was, we would have to put a lot of resources into this, but we realized, using mHealth, is the future. That's what we saw, because a lot of mHealth projects are coming up, and with mHealth you don't necessarily need internet connection, and even if you do, you can use wireless in one local area. And most of our program areas had internet connection, so we went ahead with this online capability without the offline component. And if you want to discuss more about that, I can explain why we went ahead with just the online component. Okay. Yay, I got an exception to do one more. In integrated programming, who is responsible for data analysis and learning? Ministry of Health and NGO. Who is responsible for the data analysis? So it's at all levels. It's at the health facility. So ADP, our program area level, but also at the provincial level to help supervise, to make sure that the analysis is correct. And we have been in Pakistan. Pakistan was brought up quite a few times in all the presentations. We got feedback from even the Ministry of Health, who took a look at our database and then other databases, and they found that our database was very user-friendly, and it was collecting the most essential indicators that allowed them to be able to improve the program quality. So, yeah, the Ministry of Health is using it in some countries, as well as World Vision. Other NGOs, we are discussing if there are NGOs that are interested in the database. Yeah, we're in discussion about what our future plans are with that.
Thanks. Actually, that kind of overlaps with the question that I had. One was, do you need new NGOs to join the MRP, and how does the organisation get in touch? So, yes, we're very keen to share the MRP tools with other agencies. We have an MRP team who are actually dedicated staff to support other agencies as well to use the MRP. We're really keen, particularly with the learning component of the MRP, to have as much data as possible for the analysis that we're going to be performing. So, yes, and the best person to get in contact will be with Susan Fuller. And there is a website, and all of the contact details are on there, but also happy to talk to you. The second question that I had was the technical input and buy-in across the sector from experts, and has it been agreed? In the inception of the MRP, there was a very wide consultation with a lot of agencies, most of which are in the room, including UNICEF and WFP, and they fed into all of those technical discussions about the definition and the calculation of the indicators. Now, I guess, kind of moving forward in the new phase of the MRP, we're kind of looking more to have that national level engagement. So that kind of really relies on the different agencies who have already kind of had that technical buy-in to kind of support at a national level. So I think Pakistan is a nice example, but I think that's something that we would really be hoping to replicate in other countries. Okay. And there was another question kind of related to that, is the main problem with the MRP indicators that people don't know about them or that they don't like them. And I think probably there could be maybe a combination of the two. I think at the minute we're really trying to focus on the advocacy around the standardisation of indicators, and again, as I was saying, at the national level. But one of the things that we've been finding very challenging is the way that in SFPs we're reporting on OTP discharges. So that was one of the clear recommendations from the 2008 report, that unless we're separating OTP discharges from the TSFP reporting, we are biasing the results. And Pakistan is the first country to kind of adopt that separation at a national level. So I think we've still got quite a lot of work to do on that front.
World Vision, the 3-day training that we developed includes a full couple hours on just defining and making sure that all the staff know what the definition of each indicator is, so that before they enter in the data, they know what that indicator is for. So I think that's very critical in any of these database systems, that the people who are entering the data know exactly what this indicator means, and yeah.
Thank you. So my questions are mainly actually cross-cutting, so perhaps I'll hand off also to colleagues here. But one of them is, how do the different sources of support respond to government needs? I mean, this is a big challenge. I think it's speaking to the last slide in terms of how do we all kind of come together and across our various initiatives, how do we coordinate and harmonize? I mean, it's a huge challenge, obviously. I think there's been some good instances of collaboration, and we can perhaps point to Pakistan as one. So I think sort of taking learning from that experience and trying to apply it to different contexts is one way of kind of taking that forward. Another question was around the link feedback arrow back down to the community level. So how does information not only flow up, but then feedback down? Related to the specific Vietnam example, in fact, and perhaps the unclear diagram was not very clear, in the sense that the community, the village health workers at the commune level have a monthly meeting. That's where feedback's given, likewise at the district level. But I think more broadly, it is a big challenge in terms of how does the data flow come back down. Sometimes it's in the analysis products that are produced, but often that is a missing link, and I think we're looking definitely to strengthen that. I think the final one I'll address maybe is, or try to address, is how do you ensure compiled data is analyzed and used by program staff and Ministry of Health? Yeah, I mean, that's a huge challenge. I think where we've seen some success is where the analysis products are nice, sharp, clean, succinct, but we often get, I think, mixed messages from program staff. So in Pakistan, I was there, I was told, you know, we need this, 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 but in fact, then they said, well, we don't have any time to analyze all this. So I think it's about finding that balance between what really the program staff wants that is feasible for them to use, short, succinct, and I think that's kind of the key to some of that work and something we want to take forward. Thank you. So yeah, this question is about how do all these systems link into government information systems, especially as we talk about integration. So I didn't mention, but I think there's a real push towards integrating at least the CMAM data systems into national vertical reporting systems where possible. The only really good example I can think of now is in Kenya, where they started their CMAM database as an NGO database, refined the indicators over time, and then I think in 2011, just as the HMIS was beginning to be reviewed on its regular basis, they took the opportunity then to integrate it in. I think there's some learning from that experience which is quite interesting. First, there was this period of refinement that was needed of the indicators, because once it's in the HMIS, then it's kind of stuck for a while. You can only then change it in the review periods, which are quite few and far between and can be quite cumbersome. But I think it's, you know, from a UNICEF standpoint, and I'll speak personally perhaps at this point because my boss is in the room, but I think we're definitely looking to see what work we can do to get this integration, to strengthen the integration of SAM data flow into national systems, and I guess we also count on the support of people in this room to help do that. Thanks.
So just to add on that, for World Vision, our indicators, we always take the UNICEF format that they're using in country, and then we have the training on, okay, so this indicator fits into this one for World Vision. And most of the time, they have the same wording for the indicators, but sometimes it's not exactly the same because we had to standardize our indicators across the entire partnership for all the countries, and not every country is collecting the same indicator, or the name for the indicator may not be the same. So yeah, I think it would really help us if all the countries, if UNICEF is able to standardize those indicators across all the countries, and then we would have to spend less than 4 hours to try to pair that up. But yeah, I think that would be a great way for us to go forward, and that'll help us to be able to compare countries better as well. Yeah.
Can you put an example of the saying that they're not exactly the same but almost the same?
Yes, there's one. Refer to other site. So there's an indicator called refer to other site. And for World Vision, we divide up refer to other site and refer to SC. Refer to SC is specifically for just referring to SC. But refer to other site for World Vision means to another OTP site, because that child was referred, may have migrated to another place. But for UNICEF's indicator, it says just other site, yeah, in some countries. So that's an example.
Maybe just to respond, we've done a lot of work actually at the global level in trying to pick out some kind of key indicators that we want to standardize across countries. That was part of our global SAM management update system. It's an online tool. It has a lot of detailed guidance around each indicator and some quality check points as well. So we are definitely doing something at the global level about that. And then also in our country support, I think as follow-up, we'll be trying to strengthen that. And then maybe just to add also that to build off our SAM Global Update for this coming year, we're actually creating some modules for IYCF and micronutrients. So I think the vision for this is to try and sort of bring together these different strands of information globally so that they can speak to each other. So just to kind of flag that, that's the vision going forward.
Okay, I think we're done up here.